everyone. Looking forward to chatting with you after my talk, but I will get right into it here. So here's what I'm planning to cover today. First, I'd like to start off talking about vulnerable populations and the triple jeopardy posed to them by climate change. Then I wanted to touch on a recent data set my group has produced on wildfire burn zone disasters in the United States over a 26-year period. And then I'm going to get into our work on the LA fires itself, where we looked at acute healthcare utilization in the outpatient setting and with virtual care in the week following those fires in January 2025. And then I'll finish up just mentioning a few things that we're planning to do to continue our work in this area. And apologies, I have my first daycare cold of the fall, so I'm a little snuffly. Okay, so we know that some populations face a double jeopardy of dual socioeconomic disadvantage and disproportionate environmental exposures. And these two things combined can lead to worse health outcomes. There's a lot of environmental justice work characterizing this double jeopardy. This is a paper by Vivian Doe, who completed her PhD with me at Columbia, looking at power outages in the United States and social vulnerability nationwide. And so here we're looking at bivariate Lisa clustering to identify counties in the US that have both high SVI, meaning high social vulnerability, and high counts of 8-hour or longer power outages. So these are places we might want to think about prioritizing for grid updates, solar and storage backup batteries, prioritization of power restoration for vulnerable populations, things like that. We then have this triple jeopardy that's posed by climate change. And so we have these existing environmental exposures, power outages, air pollution, existing social disadvantage from things like the housing crisis, healthcare inequities, population displacement. And on top of that, we're layering these climate hazards, wildfires, tropical cyclones, extreme heat. And this can lead to an additional push towards health disparities. And we think that there will be unequal health risk, right, under climate change. Everyone is vulnerable, but not equally vulnerable. Climate change will exacerbate, we believe, social, economic, and demographic inequalities that influence health. And it's very likely to amplify existing health threats. So let's go to our first poll question. Bill Gates from the Gates Foundation last week, I believe, wrote this piece about his feelings about climate change and health and how we should be allocating our resources. So it's a pretty interesting read. It definitely makes you think. And so thought I would have you react to his quote, and then hopefully this will propel you to go kind of read what he had to say. All right, I think we are at, yep, 71%. Okay, interesting. So, oh, I lost the percents on here. Let's see if I make it bigger. Will it tell me? Okay, I guess I have to do math. So the most popular choices here are agreement and partial agreement with what he had to say. This is interesting to me, and I'll be really curious for you to go read the full article and see what you think. I think I am probably in the partially disagree or the partially agree category. I think there's some nuance here, but I think I do feel like his comments are a little off base in some ways. So be curious for you to go take a look. Okay, I'm gonna hit the stop sharing there. Awesome. Oh, cool. Okay, I think I'm supposed to click out of this. Great. Okay, so let's carry on. How do we get to disproportionate health impacts from climate-related exposures? I think of this in two major ways. First, racialized or otherwise marginalized communities are often disproportionately exposed to climate hazards. So this is an example of some work we did in California, looking at exposure to wildfire fine particulate matter, broken down by racial and ethnic groups in the state of California from 2006 to 2020. So to orient you to this chart, along the bottom, we have year. On the y-axis, we have this exposure risk ratio, where 1 represents the group being as exposed as we'd expect based on their statewide distribution. Anything above 1 indicates this group is more exposed than we'd expect. Anything below 1 means they're less exposed. So we do see that the non-Hispanic white population in California is a little bit more exposed than we would expect based on their statewide distribution. But then we looked at other racial and ethnic groups, and we actually found that multiracial people in California are also disproportionately exposed. And then this very extreme disproportionate exposure for the American Indian and Alaska Native population in California every single year, and substantially higher than for any other group. It's also possible that disadvantaged communities are disproportionately susceptible to the same level of exposure. So here's an example of that. This is work from Marshall Burke's group at Stanford. And what they're looking at is county level median income in California. And then they're looking at days where there's fairly high smoke exposure in California. Who is searching for air filters on Google? And so they're seeing that the higher the median income of the county, the higher the likelihood that the people living there will be Googling about air filtration. So this suggests, they're probably more likely to buy air filters. They know they should be using them. They have more agency to respond. And so this also can contribute, right, to disproportionate health impacts. Okay, so let's talk about wildfire burn zone disasters. We've so far been sort of touching on wildfire smoke exposure, but the burn zones themselves can also be very harmful to health and concerning. So a little data in the United States, sorry, this is sort of US centric, but I do have some international context in a second here. Over time, we've seen an increase on average in the area burned in the US over time, as well as the costs to suppress those fires over time. We also see that looking at the most extreme wildfires, we've seen that these have been increasing in count globally, especially in Canada and the US. But no one has really studied these exposures comprehensively because there's no data set that characterizes these burn zone disasters over time. So that's what our group has been working on for, 5 years now. So I'm very excited that we finally have this data set. It's available on Harvard Dataverse for the US, and it represents wildfire burn zone disasters, which we defined as a wildfire that burned a structure, caused a civilian fatality, or received a FEMA, so federal assistance grant to fight the fire. And so we identified over 5,000 of these fires between the year 2000 and 2025. And so we now have like the spatial burn parameters, the ignition dates, the number of structures burned, all these criteria about these fires in the hope that we can go on and study them more comprehensively. Okay, second poll question. I'll let you read it to yourself so my voice can recover. Awesome. Okay. Yeah, I agree. All of the above. So I do think these burn zones certainly cause economic losses, major psychosocial stress. And out of the LA fires we've seen, especially when buildings and cars and other things are burned, there can be serious heavy metal exposure. Okay. So what have we seen thus far with these wildfire burn zone disasters in the US? Just to look at kind of some regional trends. Actually, a lot of these fires are in the southeastern US. That's the green color here. Probably not surprisingly, a large number of them are in California, represented in pink. And we don't necessarily see an upward trend in these over time. Something of interest that we do see, this is the ignition date of these disaster fires. And interestingly, they seem to be happening on average later in the year than they did earlier in the study period. So we're going from 2000 in the top to 2025 in the bottom across the US. And generally, we see this kind of rightward shift where the ignition of these disasters is happening later, which was somewhat surprising to me. I didn't really expect that. We also characterize if these fires were overlapping with the wildland urban interface. So this is where buildings and vegetation kind of directly intermingle and can, really increase the risk of wildfire ignition and the impact of these fires because of proximity to humans. In 2020, there were about 44 million homes in the United States in the WUI. And so we looked by region at the percent of these disasters occurring in the WUI. And what was kind of interesting was there were some regional differences. So in the southern part of the US, less than 50% of these disasters took place in the WUI, whereas in California, it hovered more around 75% of these. So some differences. Okay, so let's talk about a recent highly destructive WUI fire, which is the 2025 LA fires. So, January 7th, 2025, the Palisades and Eaton fires ignited in LA County. That was followed by other fires igniting in LA and nearby Ventura County. There were really strong Santa Ana winds at that time that helped spread these fires. Ultimately, they burned about 38,000 acres, destroying over 16,000 structures. This recent research letter in JAMA suggested about 440 people died that would not have in the absence of these fires. And so we were interested in whether these fires impacted healthcare utilization. And I think about why that might happen for three major reasons. The first is the air quality wasn't great in LA during this time period. So here I'm showing you the locations of US federal EPA monitors for fine particulate matter, or PM 2.5. And on the right, I'm showing you from the ignition date over the first week, the daily average PM 2.5 concentration at each of these monitors. Those in LA County are colored orange. And you can see that's where we had some quite high PM 2.5. Now, this is averaged across the day. There were hours during, especially on the 8th, where PM 2.5 concentrations exceeded 400 micrograms per meter cubed, but it was just for a short portion of the day. I think evacuation also likely plays a role in impacting health. So these are the evacuation zones for all the fires that took place in LA. So you can see a lot of people were displaced, potentially harming health. And then finally, serious psychosocial stress occurring. So Los Angeles public schools were shut down for a week. People were concerned about whether they would have to evacuate, whether the smoke was harming their health. It was all over the news. This was a very stressful time in Los Angeles. So let's do a poll question thinking about the prior literature. What kind of health outcomes would we expect in the short term following this wildfire event? Okay. So I believe the answer is respiratory events. I'm not aware of any studies that have looked at earaches, and I'm also not aware of any studies that have looked at the relationship between wildfire smoke and acute dementia incidents. There are now a couple studies that have looked at long-term exposure to wildfire smoke over a multi-year period and increased risk of dementia incidents, but not in the short term like this, not in the following week. I don't think we'd expect dementia onset to happen quite so quickly after exposure. Great. Okay, onward. So we wanted to ask this question. Did healthcare utilization change during the first week following the LA fire's ignition on January 7th, 2025? And this was in partnership with Kaiser Permanente Southern California that serves about 20% of insured people in LA. We were able to access data on outpatient care utilization and virtual visits. It takes longer for the diagnostic codes to settle on emergency visits and inpatient visits. And so actually we're now working on a second follow-up study looking at those. So in this first initial look, we wanted to assign exposure in a relatively simple way. So from Kaiser, we identified the census tract, which is a neighborhood that about 3,000 people live in. They're pretty small in size. We identified census tracts within 20 kilometers of a burn zone, and we called those highly exposed. So that's the kind of red-orange color. The more peach, moderately exposed, consisted of all census tracts farther than 20 kilometers from a burn zone, but still within LA County. And then we called the rest of Kaiser's catchment area minimally exposed. And so we had about 3.7 million Kaiser members that we could link based on their census tract of residents this way. So then we had data on, like I said, outpatient and virtual care utilization across a range of causes at the daily level. So we had all-cause visits, cardiovascular related, injury, neuropsych, and respiratory visits. And so within each of those exposure categories, we ran separate two-stage interrupted time series using data from November to January 2022 to 2025. So basically what this does is we first fit a model that predicted the trend and the outcome well in the pre-period, so up to the date when the fire actually occurred. So we had the observed data, which are represented by these black dots, and then we had our model that we fit the prediction of. Then we predicted this counterfactual number of visits forward in time based on our trend in the past and compared that to what we actually observed in the week following the fire. So let's say we predict this dashed green line and we observe these black dots. So the difference between these two would be the excess visits that we're attributing to the fire. So what do the results look like here? This is in the outpatient setting for cardiovascular and respiratory visits. We saw that in the week following, we saw about a 30% increase in respiratory visits in the outpatient setting, both in the moderately and highly exposed groups. In the virtual setting, we saw even greater increases in care utilization, both for cardiovascular and respiratory outcomes. Here we saw about a 40% increase above expected care utilization. Now turning to our injury and neuropsych results. For both, we saw on this first day of the fire increased utilization for those two causes in the outpatient setting, and about an 18% increase over the following week for both neuropsych and injury visits across these two groups. Now, I said we called the highly exposed group those census tracts within 20 kilometers of a burn zone. We wanted to check to see whether altering that buffer would change our results. So we used a 10-kilometer buffer, so these people would be even more exposed on average. And so essentially what we saw was results were fairly similar to the 20-kilometer buffer, but we did see something sort of interesting for injury visits. And so when we looked at this 10-kilometer buffer, we saw a greater signal for virtual care visits for injury, where we saw on average about a 31% increase in injury visits above what we would have expected over the 3 days following the fire ignition. And so this would be consistent with these people being highly exposed, having to evacuate, potentially having burns, motor vehicle crashes, things like that. And so this was somewhat interesting to us. Okay, so in summary for this study, we then also went and applied these estimates to all insured LA County residents to try to get an estimate of how much excess care utilization took place across LA County due to these fires. And we estimated about 16,000 excess virtual cardiovascular disease visits, 18,000 excess virtual respiratory visits, and nearly 28,000 excess respiratory outpatient care visits over this single week period following the fires. And this heavy reliance and increase in virtual care utilization made us conclude that virtual care might become increasingly important during these types of disruptive climate events. So let me finish up just with sort of some next steps and what we are thinking about going forward. So one interesting thing with Kaiser is we utilize census tracts for these initial analyses, but we actually have residential address for these 3.7 million people. So we know house by house where people are living. And so we can link them. And this is using satellite imagery, looking at building damage from these fires. And so this is pre-fire, this is post-fire. And so we actually can identify which patients lived in homes that burned from the fires and who lived in, let's say, a block or two away from homes that burned, and do a much more careful job assigning exposure that way. In this next paper, we're working on looking at changes in emergency department utilization and hospitalizations. We're also assigning exposure slightly differently. So we're actually identifying census tracts that were evacuated during the fire and considering that as an important exposure. And we're also using high split modeling trajectories to look at air quality more explicitly during this event, and then linking that to PM 2.5 concentrations from US EPA air quality monitors. So we'll be incorporating more carefully evacuation and air quality into future analyses. And I will stop there so we have plenty of time to chat, but a huge thank you to many people involved in these studies, especially the students who have done a lot of the coding and a lot of the work here, and my collaborators at Kaiser who were highly impacted by these fires and yet still kind of persevered and have done some really excellent research. So thank you very much.